So welcome back to the final session of WISH on Day 1. I want to thank you for joining us. My name is Ashley McKim. I'm Director of Innovation and Improvement at the British Medical Journal, and I have the pleasure of moderating today's session. This is the Agora. If you've been to Athens on the way up Acropolis Hill, you'll see a large stone marking the site of the ancient Agora, a site where leaders, communities, and expert witnesses would come to share their news and exchange views. Those discussions and debates continue for days. You will, however, be pleased to hear that we've condensed our discussions into just 45 minutes. We'll be considering the question, in the time of COVID-19, have all other diseases become neglected? We hope you'll also discuss this via the WISH website and in social media. We'll have a panel of 12 members of the WISH community who I'll bring into the conversation in a few minutes, but I want to first turn to Michael Byrne, who is Head of Technical Advice and Partnership at the Global Fund to Fight HIV, Tuberculosis and Malaria. Michael, I want to kick off discussions today and get your thoughts on whether it's made it harder for governments and NGOs to pledge the much needed money we need for global health initiatives because of COVID. Michael.
Thank you and good evening all. It's a pleasure to be here with you. So mobilizing resources for health takes a lot of effort, and it's more difficult in resource-constrained environments. So the negative socioeconomic and fiscal space impacts from COVID will make it even harder in the coming years for financing for health. But the imperative to invest in global health initiatives is stronger and more important to undo COVID's negative effects. Prior to COVID, Global Fund and other international organizations like Gavi secured significant pledges for our mandates. Global Fund is currently investing over $14 billion in 120 countries as a result of our 2019 replenishment. And that's thanks to the support from a large coalition of governments, foundations, civil society and private sector partners. And more importantly, based on the terrific progress we've achieved in the fight against HIV, TB and malaria, saving 38 million lives, 6 million in 2019, and cutting the mortality from the three diseases by half since the peak of the epidemics. It was our largest ever replenishment, and Qatar, one of our partners, boldly increased its pledge by 5 times. So we continue working with our partners and governments to ensure that these pledges are realised, and we're quite confident that they will be. And as part of the COVID response, Global Fund is lending its expertise to the international community in response through playing a key part in the ACTA, the Access to COVID Tools Accelerator, which is a groundbreaking coalition of global health partners to develop and deploy vaccines, treatment, diagnostics and health systems to help the fight COVID. The innovative mechanisms have made major achievements, but more is needed and funding is required. ACTA's financial ask is 38 billion, of which 10 billion has been already secured, but there's still 28 billion outstanding, including 4.6 for immediate needs. Global Fund is estimated that it needs 5 billion to support the ACTA effort to mitigate the impact of COVID on HIV, TB area programs, reinforced health systems, and support national responses, including to protect frontline health workers. So the fight against COVID is not just about vaccines, it's also about diagnostics and health systems for delivery, which are also critical. I think importantly too, it will be essential to mobilise resources beyond the usual official development assistance budget, as this will not be sufficient to support access for health for all. So ACTA A partners are calling on the G20 to urgently mobilise the 4.6 billion to treat and the causes and not just the consequences of the pandemic. Thank you.
So Michael, thank you. It sounds like you're doing fantastic work during this period to kind of continue the work that you're doing already. I want to ask you directly, so the areas that you focus on, particularly malaria, AIDS, TB, are we at risk of undoing a lot of that work because of COVID?
So we started 2020 acutely aware that we were off track on all 3 diseases towards the 2030 disease goals. On HIV, for example, continued progress in reducing deaths has not been matched with reducing new infections, which was 1.7 million in 2019 and flat over 2018. On TB, we're making great progress in finding missing cases. We still have 3 million people on TB that remain untreated and undiagnosed, and we have about 1.5 million deaths annually. On malaria, we're also making progress on reducing deaths, and we're making little progress on reducing the actual number of cases. And we are seeing alarming increases of cases in some of the highest burden countries. The knock-on effect of COVID is catastrophic for other diseases. Deaths from HIV, TB, and malaria could double in the coming year, putting at risk decades of hard-won, hard-fought progress. We see programs significantly and severely disrupted by COVID-19. Reduced TB and HIV prevention services, leading to potential rise in new infections. We've seen HIV testing decrease by 50% in some cases. We are seeing a resurgence of human rights-related barriers to accessing health services, gender-based violence and stigma. We're also seeing a diversion of resources and equipment to the COVID response. For example, we see lab capacity being diverted from testing TB and HIV viral load towards COVID testing. We're seeing too significant pressure on primary healthcare systems and increasing reluctance to seek healthcare for fear of COVID-19. And that, for example, has undermined service and treat for malaria. Marginalized and key populations are the most vulnerable. They're the first to lose access to services when health systems become overwhelmed, and they're the first to suffer stigma and discrimination, which can resurface under the guise of public health. Now, the fight against HIV, TB, and malaria and the fight against COVID are the same fight. And all the expertise that we have in fighting the three diseases can be used for fighting other infectious diseases, COVID. And that's why Global Fund is part of the ACTA coalition. And we also, country level, that the expertise gaining and scaling up HIV, TB, and malaria programs is proving a robust foundation for how countries are adapting to the fight against COVID. To protect the hard-won gains and sustain momentum against the three diseases, Global Fund took action and mobilized $1 billion to support countries for pure COVID responses, mitigate impacts on TB, HIV, and malaria programs, and to strengthen community systems. And we're also working with countries to adapt their disease programs to the COVID context. So, for example, changing policies for TB and HIV medicines to enable people more easily get and stay on their treatment. Changing how we organize mass campaigns for protection against malaria, moving from mass campaigns towards door-to-door distributions. And also putting more emphasis on an increased role of community health workers in providing basic healthcare services for a more people-centered approach. Thank you.
Thank you, Michael. So we'll continue these discussions over the next 30 minutes or so. I want to take a pause for a second to bring in the rest of our Agora. So we'll pause for a minute, we'll come back and we'll have those discussions afterwards. So welcome back, and pleased to have our additional members of our Agora with us on the screen, joining us from all over the world. But I'm afraid we're going to go to the old school method of raising your hand on screen. So I'm hoping we'll have a great discussion over the next 30 minutes. We want you to contribute your thoughts, your ideas, ask some questions, bring in some of the thoughts that Michael had as well. So please, if you've got a point to raise, please raise your hand and we'll come to you as we go through. I'd ask you first of all to introduce yourself, your name and your organisation before you speak. So please do raise your hand if you have any questions right now. One of the things I want to start off by talking about is really that first question about fatigue, that we've had COVID now for, coming up to 10 months of the year. Many of our Agora panelists are either people who run healthcare systems, they're people involved in NGO charity work that happens around the world, or delivery of service. I'd love to hear your thoughts about whether you feel that we're starting to reach fatigue in the system and the impact that will have for you in treating other diseases, mental health, cancer, neglected diseases as well. Any comments from our panel on that? Maybe I can talk to Kate first of all. I know, Kate, if you're on the call, coming from your background in Orbis, any reflections on how that might affect you and your organisation going forward?
I think it's early days so far for fatigue to set in, but the one thing we are facing is just a huge backlog. And I can talk about the Rohingya project, which is funded by QFFD and has been funded by the past 3 years. And to give like a snapshot of what the backlog is that we usually see 6,000. We usually treat 6,000 people for surgeries over 3 to 4 months. And while that camp was locked down, we basically were only able to treat 38 people. And so you can see how the backlog is just going to grow and grow and grow. And that will inevitably soon have a fatigue effect on staff. And today I was just talking to one of the team, and he was telling me about the bus driver. So the bus driver now has to make multiple visits in and out of the camp. And just small things, bringing it down to kind of a very personal level. So he's having to work twice as hard. The screening team's having to work twice as hard. The people, the surgical staff at the hospital are now having to work 3 or 4 times as hard in order to meet the huge backlog that is now building up over due to just a 3 or 4 month lockdown. And then going forward, we don't know how long. Services are not at full capacity. They won't be at full capacity for a long time. So we're going to be working in this slower, more intensive way in terms of social distancing, use of PPE equipment, like the chap was saying earlier about working at more community level, going door to door. It's slower, more intensive, and also more costly. And I think that is a key point that needs to be examined further.
So thank you, Kate. It's really great to get that experience from on the ground from the global health perspective. I'd like to bring in some of our other panelists. I know some of you come from backgrounds working in healthcare organisations. I know in England, where we're broadcasting from today, that our waiting lists for some surgeries have now risen because we've been closing hospitals for COVID, and some of those are now back to the 2008 as far as waiting times for patients there. Any reflections from people running organisations about the impact that's having on other services, cancer, mental health, examples like that? Yes, please go ahead.
So Jim Cleary, I'm at Indiana University, the Simon Cancer Center there, and lead supportive oncology and palliative care. Across the cancer spectrum, we're actually seeing a drop-off in services. Prevention services, so if we look at giving vaccination for HPV, screening services, people not coming for colonoscopies, not coming for mammograms because they can't do this. And we're actually seeing people not come for treatment. And that's not just in Indiana, but it's global. When you have a country shut down, how do you even get in for care? And I'll finish by saying that we're actually also seeing a drop-off in palliative care services. And across the board, we now have millions of people in the world dying alone without their families present because of COVID. So this is a dramatic impact, which I think we're not even addressing. How do we provide care for people with COVID and other diseases, given the infectivity of this virus?
Thank you, Ian. And I think we had a comment from somebody else in the panel I want to bring in.
Yes, hi. My name is Kashif Ijaz, and I'm the Vice President. Hi, my name is Kashif Ijaz, and I'm the Vice President for Health at the Carter Center. In our experience, because we are actually involved in the control and elimination and eradication of neglected tropical diseases, for instance, in guinea worm, we have been doing pretty well even during the era of COVID. We're about 90-95% operational. And, our community event-based surveillance has been going really strong. And, as a result of that, we have seen a decline in the guinea worm cases, human cases, about 56%. They're down to about 24 from as compared to last year. And then, we've also been seeing a decline in dog infections, about 26% as well. And it's not because of lack of surveillance, but it's actually because we are still seeing a lot of good community event-based surveillance. On the other side, when you're looking at some of the other neglected tropical diseases like river blindness, as well as trachoma, and lymphatic filariasis, we've been dealing with what I call as building back better, in terms of trying to do the MDAs the master administrations and restarting that because based on WHO's advice, we had actually stopped doing that, but now they've actually put out guidance on how to restart it. And we've been doing risk assessment and mitigation action reviews in order to restart some of those efforts in countries like Uganda, where we are actually starting the MDAs for river blindness. And in addition to that, we are also doing MDA with a triple drug for the very first time for lymphatic filariasis in Haiti. So I think yes, I mean there is a silver lining to the dark cloud, as I say, in order to sort of get back to where we need to be, which would require a lot more effort in terms of assessments, because there's also there would need to be obviously a PPE provided, as well as in addition to that integration and coordination of efforts with the ministries of health, because in order to avoid both the community fatigue who are actually going to get these MDAs, but also the community health workers and sort of coordinating with them as well. So I'll just stop there. Thank you.
Wonderful, thank you. And it's nice to hear some positive views for the future of how we come out of COVID as well. Let me invite some of our other panelists who haven't spoken yet to come in and join us. If you'd like to just come in and raise your hand, that would be fantastic. Anybody from
Dee Dee Thompson.
Please go ahead. Unfortunately, I can't see your name, but please go ahead and join us.
Sorry, this is Dee Dee Thompson. I'm one of the research partners from WISH and an honorary fellow at Imperial College. I think the interesting things that we've seen from the COVID pandemic has really been the shift to a massive uptake in telemedicine and digital and data solutions. And I think that's something that could be seen as a positive for the future, but also needs to be viewed, I guess, a bit warily in terms of the digital divide. So some people are very comfortable with internet access, with accessing care that way, but we really risk kind of losing those people that may not have internet access, that may be elderly, that may not be sort of hip to the digital age. And I think that's something moving forward that we really need to think about, because I don't think that there's any going back to the pre-COVID era of not having digital consultations first. And I think that's, a bit of a mixed message, and it'll be interesting to see how that plays out. Thank you.
Thank you, Dee Dee. And I want to bring in some of our panelists again as well. That I'd hope, and we've seen in previous pandemics, that amongst all the pain, the suffering, the deaths that we unfortunately see, there's also a lot of innovation. And we've seen in previous, from right back from smallpox, the innovation of the formation of global bodies that will help to tackle health, but also through this innovation in everything from track and trace to vaccine development. So let me bring in, I think somebody just raised their hand there to come in and make some comments on that. Let's continue that discussion on how we might be able to innovate to tackle some of those diseases that have been neglected. Yes, please go ahead.
Yes, thank you. I'm Dina Lasfour from Oman, and I'm glad you brought up the innovation, because from what we've seen here, there was a remarkable resilience in the system where we've seen primary health workers and other workers have done amazing things just to adapt to the situation and make sure that every child gets immunized and every patient gets seen. So we have, to talk about, for example, digitization. In cases where there is not available computers, there was always phone calls to the patients, and there were and there was some creative things, like patients were given their medicines, were asked to stay in their cars, and the doctor would or the nurse would go out and give them their medicine in the car to avoid the crowdedness of primary healthcare places. And there are many examples to that. So one thing that I wanted to raise as well is that this issue, it brings the question of resilience in health systems, for which we have been discussing for many years. But COVID showed us that resilience is an essential component of the health system, and it's an important pillar. And we should not be relying just on how strong is the health system at the times of comfort, but also at the times of crisis. Thank you.
Thank you for sharing that. And I hope that throughout the rest of this week at WISH, this is all about innovation. It's about those ideas that we're going to be improving healthcare, that we'll all be able to pick up things that we can take back into our respective organisations and help to make a sort of evidence-based approach to how we improve care for all those other conditions that, as we've discussed today, may be neglected somewhat during COVID as well. Anybody else want to come in on that? Let's maybe continue the discussion on innovation a little bit. Anybody who's not joined us yet who wants to bring their experience from their organisation to this panel? And if not, maybe I can come back to our colleague from the Carter Centre and just maybe reflect on your thoughts on that. Didi earlier mentioned about the fact that we have to be very careful of this digital divide, creeping up, and for cost-constrained economies from low-income countries who are maybe tackling those other diseases. Any thoughts from your perspective around how we can apply technologies that don't neglect those populations and don't neglect the diseases that affect those populations?
Yeah, thank you very much for the question. I think that, definitely in terms of training, we will actually have to do a distance learning and distance training, because we've actually done that for some of the laboratorians, on the diagnostic side of things, where we've actually basically gone to them and provided them with experience related to some of the methodology, and the methodological changes or advancements in terms of innovation of some of the diagnostic tests. So that is definitely an area where we can actually work together, in terms of using the learning technology in an era of COVID. But then in addition to that, like I was mentioning before, there's definitely, when you're doing the MDAs or the master administrations, you definitely have to do it, and do some field work. And that's where the policies and the SOPs really become important to make sure that the healthcare workers are, protected, and there is enough personal protective equipment available for them, whether through donations or through the Ministries of Health, and that's where the collaborations become really, really important. In addition to that, I think you mentioned a little bit about the mental health aspects as well, and Carter Center has been, our mental health program has been working, especially on the lymphatic filariasis, and that's where we have seen some good interactions between the mental health and the LF related to chronic disease, self-management and intervention efforts in Haiti. And then, so in the era of COVID, we have been actually, practicing social distancing and still, helping them as much as we can in terms of mental health efforts. So I'll just stop there. Thank you.
Wonderful, thank
you.
So
technology has actually helped a lot.
We've got 4 new panelists with us. Thank you. For our new panelists who just joined us, again, please contribute to the discussion. This is an open discussion. Please raise your hand in the old-fashioned way. I unfortunately can't see who you are or where you are, but if you raise your hand, we'll come to you and put you on the big screen and take your question. So we've got a gentleman I can just see in the bottom of the screen with glasses, with red carpet behind him. If we can go to him, and we'll take your point.
Yes. Hello, I'm Ahmed Dalal. I'm the Dean of Georgetown University in Qatar. I'm not in the medical profession, but speaking of innovation and in terms of policy, I think there are obviously in relatively wealthy and affluent societies, there are huge challenges that the pandemic has presented. We've seen, as has been already noted, a dramatic decline in preventive screening and monitoring of chronic diseases, and for understandable reasons, for fear, number one. People were and continue to be afraid. Actually, every time I go to a regular checkup, I worry tremendously, and I think it's only not normal to do that. I think the medical systems they have developed and continue to develop, especially in affluent societies, mechanisms to deal with medical care, with regular medical care under current conditions. But there is so much more that needs to be done. There are also other challenges, even in affluent societies. Challenges such as how do you collect test samples, insurance systems and how do they apply in the conditions of the pandemic. That said, I think we also need to think of the longer-term consequences of the pandemic for poor countries with fragile health systems. I think this is so much more serious, and it has huge long-term effects. Already, the current recommended strategies to reduce transmission, isolation, the use of protective gear and protective PPE, and so on. All of these measures are extremely limited in many parts of the world, in huge parts of the world. There are limited availability of protective equipment. The high percentages of populations who live in settings where social distancing and hygiene are physically impossible in many cases, or extremely difficult. Even if the population is prepared to adhere to these measures. Medical and health staff are at very high risk. There is a shortage of medical and health staff, and then, of course, under the current conditions, they're at very high risk. So there is a shortage and depletion in medical staff. There is also a prevalence of multiple diseases, chronic diseases, immunodeficiencies, and so on and so forth, in many of these same parts of the world. And patients in need of specialist care in rural areas and rural settings are unable to access medical care, and so on. Immunization programs are severely compromised currently, and I think there are lots of indications that this will only become harder under current conditions. So I think it is important to develop strategies for these parts of the world. I mean, it's already hard enough in affluent, but in these other societies, it is potentially disastrous. Add to that camps, refugee camps, displaced populations, areas which are plagued with violence and conflict, areas which have food shortages. Natural disasters. I mean, there are parts of the world which are suffering from locust swarms. I mean, swarms as if we don't have enough disasters on our hands. There are all sorts of. There are other areas, of course, where we have other pandemics, which are still, which are still there and still quite risky and dangerous. So I think it's extremely important to start thinking of these areas and develop, as some of the, as I'm sure. I'm sure some major international organizations are thinking of that, but I think this is where the real challenge lies in the long term. And I think just to add, to conclude, I think it is important when thinking of these situations to think of measures which draw on local, customize the solutions to the specific locales in which need intervention, and mobilize the local communities in thinking about solutions. I don't think there is one solution that fits all. I think it's a luxury to think about the use of technology and so on and so forth. And maybe there is some use of technology in some of these locales, but I think it's much more important to think realistically of solutions that cater to the specific situations in which people live. As I said, I'm not in the medical. My father worked for the WHO for many years, and he worked in situations like this. He gave me a sense of the type of interventions that are workable in different. He worked in different countries in Africa, and I sort of have a sense of flavor. But coming from a school of foreign service, where we deal with policy issues, I think it's extremely important to develop policies for long-term solutions.
Yes. Wonderful. Thank you. Well, as you pointed out, I think we've got lots of challenges, globally in healthcare to deal with over the next couple of years, and I know we're addressing some of those during this week at WISH as well in the future panelists. Let me bring in some people. I know some people have just joined us. For those who haven't had a chance to speak yet. Anybody like to make a comment if you haven't spoken yet? Just please raise your hand and we'll come to you just for a quick comment before we end. Yes, is that Faraz? Faraz, please go ahead.
Yeah, that's me. So this might be slightly murky territory that I'm. Hold on, is my mic on? Let me. Okay. So I
Yes,
might
we
be
can hear
going
you.
to
Go
slightly
ahead.
murky territory. There is the obvious effect that COVID has had on the planet, tangible effect. If we're talking about how cross-cutting it is, how it's basically brought the world to its knees. But I think another thing, a bit of an elephant in the room that nobody really mentions, is it's quite politicized compared to other infectious diseases, at least in my living memory. And I feel like that might be a factor that might be considered if we're talking about diverting momentum to other infectious diseases as well. Would you say this is a valid comment or not? I defer to the jury.
Any reflections on that political aspect of how we've dealt with COVID?
It's certainly politicized here in the United States.
Your hand, but if you're raising
Mask
your hand,
wearing
please
has
go ahead and
become
jump
very.
in. Sorry,
I wonder if I could pick up. Can you hear me?
We can hear you, yes. Please
Hi.
go ahead.
Hi, Ian Tully. I'm the Chief Executive of the Mental Health Service at Hamad Medical Corporation here in Qatar, and the National Strategy Lead for Mental Health and Wellbeing. I wasn't going to comment on the politicization, but I wonder whether or not I could relate to some aspects of mental health and go back to the point on innovation. Now we've heard about the challenges of people who have struggled to access services, particularly those with non-communicable disease, hypertension, diabetes, cancer, etc. In a specialty like psychiatric mental health that was struggling anyway, it seems to me that the challenge has only got bigger as a result of COVID. Now, I think a blessing from COVID is that it seems much more normal to talk about mental health and psychological distress as a result of COVID. We've seen a huge rise in those people who are seeking help from our services, and we opened a national helpline in Qatar, and we've seen a massive rise of people who are seeking some form of psychological support. Now, I noticed last week, for example, that NHS England published their new metrics for monitoring the impact of COVID, and of the 17 new metrics that they introduced, 14 of them related to mental health and psychological distress and the use of drugs and alcohol. And it seems to me we have got, yes, we're dealing with a pandemic, but we've got an epidemic of mental health, and the aftermath and collateral effect of COVID is going to be huge on our psychological well-being. So I think in terms of how are we going to, if we were struggling in the past, what does the future look like? So I think the benefit of people being prepared to talk about mental health is a step forward. But how do we use innovation and technology to provide much greater access to people? How do we ensure that all healthcare staff are equipped with the skills and capability to at least understand when someone is presenting with an anxiety problem or depression, etc. And I think we need to find a way of almost mass training people so that they can start to identify and respond to the needs of people with a mental health difficulty. And I do think technology plays a massive part on that. But the human effort and the human capital that we will need to invest will be far greater than we've ever done before. So I would hope that that we can start thinking around the world about how we use the human capital we've got to provide much greater access to those people who will suffer over the several years to come.
Thank you. And I think it feeds into a lot of what we talked about today at Wish, that actually a lot of the world came together to deal with the pandemic. And I think, as you're saying, that we need to all get together to deal with some of the implications and other diseases as we move forward as well. So we've only got a couple of minutes left. I want to come back. I know we had a sort of point or somebody raised. It was a lady who's on my screen I can see with some beautiful fern wallpaper behind her. If you'd like to come in and add to the conversation.
Yeah, about the misinformation, about the politicization. I think COVID came in at a time. The world is really different from the Spanish flu. We are living in a very complex world with a lot of political unrest, a lot of conflict between nations, and technology booming. So all that, I think, fed into the conspiracy theory of COVID, and made it sound political. But it's actually, today I was telling someone who sent me a message on WhatsApp, and this is one, that happens every day almost. Someone sending you a message that this is all a political thing and it is a conspiracy and so on. And I responded to her, 1 million people have died so far. That's not political at all. That's people's livelihood and survival and poverty that are suffering from. So I think the world is different now, and that's what made it look as if it is a political issue. And I'll stop here.
And my final question, I want to ask you one final question before we just end. Do you feel positive or negative towards the future of the impact on other diseases, neglected diseases going forward from COVID after the discussion today? We're getting away from
I would say that I would say that we should still be optimistic about it. I mean, yes, we're dealing with a challenge, but a challenging situation certainly. But we have done this before. I mean, post SARS and H1N1, and then so there have been challenges and challenging situations before as well. So Ebola is another one, which we have actually done a lot of good work in building health systems post-Ebola in Africa, certainly. So I do think that I certainly remain optimistic about being able to, what I called as building back better. So I hope my other colleagues and on the panel also feel the same way, because that's the only way you can feel in public health. Thank you.
If I may.
Anybody else, if you raise your hand, if you think we can build back better.
If I may, just a
Quite
quick
a few positive
comment.
People. Fantastic, thank you.
I think the pandemic has been a wake-up call. I mean, there has always been other diseases that are probably more deadly in terms of the amount of people that they kill, but they've been localized. This one does not distinguish between anyone. I mean, it's become a global pandemic, and it's affected everyone, and it's brought economies to a halt, and it had so it had impact on everyone. So hopefully, if we learn the lessons of this pandemic, there is hope, but there is no guarantee that will. And I think it's important that we continue to be aware, to try to learn the lessons of this pandemic and the vulnerability of humanity as a whole, and the weaknesses and the gaps in our preparedness and in our social systems and in our economic systems. Wonderful. And our ability to prepare for situations like this. If we learn the lessons of this pandemic, then there is hope, but there is no guarantee that we will. And I think we have to be diligent, and there has to be a high level of awareness if there's something good that's going to come out from this. Because so far, it hasn't been good. So far, it's been
wonderful.
The effects of
I'm going to have to stop you there because we're going to run out of time very soon. But thank you for your comments today. And I want to thank all of our panelists. It's been fantastic to hear reflections from all over the world, from different backgrounds, from different organizations. We've got a tough couple of years ahead after COVID to make sure we don't leave these neglected diseases to get worse. But I think there's a lot of enthusiasm there, and I think on general, the positivity of us working together to solve this is there as well. We'll be covering this during the rest of the week at WISH, so please join us for the rest of the sessions. Please continue this discussion on WISH, on the website, and on social media as well. Thank you for joining us. We hope you enjoyed today, and we'll see you again tomorrow. So thank you and good night.